This is a short presentation recapping primary care and medical screening options in King County. So the purpose of this very short presentation is to just bring both of these systems together in a visual way so that caseworkers can see how both the medical screening and the primary care fit together. So on this slide, you can see the flow from the perspective of the VOLEG and thinking through what are the basic health responsibilities of a resettlement caseworker, and then which track to take based on the type of case that you have. This slide shows the same information, but from a slightly different perspective. This is looking at a new arrival and then determining the type of case and seeing how they track through the system established in King County. So to end, I'm just going to walk through what to do if you aren't sure if your case is a complex medical case or a routine case, and therefore you're not sure which systems to connect them with. So there are a lot of reasons why you might not be sure, but I'm going to discuss two different scenarios in which you do have medical records and which you don't. So let's say you have a case coming in and there's no medical records available either prior to arrival or directly after arrival. For those cases, as you can see at the bottom of this slide, you're simply going to connect them to the systems that you would at any other routine case, because there's no information that you have available to you to determine that it's not a routine case. And we'll get into some other topics in future videos about the scenario in which a case does end up being complex. But usually, if you don't have any medical records or information, you're not going to know that, and you're just going to put them through the routine systems that are in place, going to Health Point for primary care, and then downtown public health for the medical screening. So let's say you do have medical records, but you're still not sure, based on those records, if a case is complex or not. And this is where referring to the Harborview nurses can be really, really helpful, and is something in their purview. So while they obviously want to make sure that the complex cases are taken care of and connected to care quickly, another resource that the nurses provide is really looking through medical records and helping you triage what is a complex case versus a routine case. And we'll get into this further in another presentation, but for now, just keep in mind that that's always an avenue at your disposal to use if you are still not sure what type of case it is, even with some medical records.